November 2019, when COVID-19 shocked the world.
Coronavirus hit.
COVID-19 still
deadly coronavirus.
COVID-19, the disease that defined our lives in 2020.
2020 is now the deadliest year in U.S. history.
It was first reported in Wuhan, China, and subsequently spread worldwide. Most of us are scared, and discrimination against each other increased. Many people died and tested positive day by day all over the world. A lot of dead bodies were left outside and burned. It's been almost 4 years since the pandemic happened, and here we go again. Another kind of virus are spreading again. It is commonly known as the Nipah virus. There has been an outbreak of the deadly Nipah virus in Kerala, India. 5 people have caught the virus, 2 of whom have died. The authorities in the Kozhikode district, where the outbreak occurred, have instituted containment zones in the area, and schools have been closed. 76 people who came into contact with the infected are being closely monitored for signs of the disease. This is the 4th Nipah virus outbreak in Kerala. The most deadly was in 2018, with 18 laboratory-confirmed cases and 5 suspected cases, 17 of whom died. Nipah virus is an RNA virus of the Paramyxoviridae family. The first detected human outbreak occurred in Malaysia in 1998 and caused 265 cases and 105 deaths. Since then, 1 or 2 outbreaks occur each year. More than half the people who are infected die. There are no specific drugs to treat Nipah virus, so medical care is merely supportive. That is, treating individual symptoms and keeping the patient comfortable until they hopefully recover. Some treatments look as though they have potential, at least in animal studies, but few studies have been conducted in humans. One small trial of a drug called ribavirin suggested it could reduce deaths, but more studies need to be done. A targeted therapy called monoclonal antibodies have been shown to be effective at reducing death in green monkeys if given early enough in the course of a Nipah virus infection. But no studies have yet shown how effective these drugs are in humans with Nipah virus. Nevertheless, the Indian authorities are buying monoclonal antibodies from Australia to use in the current outbreak. How do people get infected? In the original outbreak in Malaysia, the main risk factor was contact with pigs or being a pig farmer, but there was no evidence of person-to-person transmission. At the time, it was not clear why pigs had started transmitting the infection. Since the initial outbreak, we have learned more about the virus and the risk factors associated with transmission to humans. It is now accepted that the primary host for Nipah virus is fruit bats, specifically the Indian flying fox. Nipah virus has been previously detected in bats in Kerala. Most infections are thought to come from contact with an infected animal, either the fruit bats themselves or from intermediate animals such as pigs, as in the first detected outbreak in Malaysia. But there are interesting differences between outbreaks. In Bangladesh, there is an association with drinking date palm sap, either raw or fermented. In one Bangladeshi study, the researchers used motion sensor infrared cameras to show that fruit bats often visited those date palms where villagers collected date palm sap for consumption. Person-to-person transmission did not occur for Nipah virus, as no healthcare workers were infected during the large outbreak in Malaysia. Since then, healthcare workers have been reported as having caught the infection, as in this most recent outbreak, where one of the deaths was in a healthcare worker who treated a person infected with the virus. Deadly, but doesn't transmit easily, a study of some 248 Nipah virus infections in Bangladesh, conducted over several years, concluded that about a third had been caught from another human. If you like what you saw, consider subscribing to my channel. Let me know what you think in the comments section. Leave a like and share this video. See you in the next one. Thank you for watching.